I warmly welcome Professor Hemamali Pereira, President of Sri Lanka Association of Child Development, to deliver the welcome speech.
Thank you and welcome to this second annual conference of Sri Lanka Association for Child Development. I warmly welcome you and thank you for being here. Our chief guest, Professor Priyani Soisa. Madam, we are honored to have you with us. A distinguished pediatrician like you who pioneered child development work in Sri Lanka. Our guest of honor, Dr. Arvind Mathur, head of the country WHO office. Thank you for being here, sir. It's a privilege to have you, and WHO has always supported us in our work, technically and financially, and we are truly grateful for that. Our special guest was to be Dr. Sudashini Fernando Pulle. I think she's held back for some reason, but yet still I would like to introduce her. She's a community physician, and was in charge of the early childhood program at the Family Health Bureau for several years before she changed her hat and decided to be a politician. But she still assures us her lot of support. Guests from India, thank you for being here. Even with last minute crisis, all three of you weathered all that and have arrived. Mary Barua, thank you for being here and accepting our invitation. She's a truly great lady. She is in charge of the she is the founder and the director of Action for Autism. So she is an ideal person to be here. And thank you, Mary, for being here despite a conference, your own conference coming up very soon. Professor Shobha Srinath, the head of the Child and Adolescent Psychiatry Unit at NIMHANS, which is a very large organization in India. She has done a lot of work. She's one of the authors of a recently published book from the Royal College of Psychiatrists titled Where There Are No Child Psychiatrists. Dr. Nalini, a special educator. Thank you for being here, Nalini, and we look forward to hearing your contribution. All the invitees, we are honored by your presence, and all the participants, and ladies and gentlemen, thank you for being here. I'll move straight into my presidential address. This year's theme, Join Hands for Child Development, has a meaning to it. We really need everybody to join hands. And when I say everybody, it starts from the general public, the parents, the media people, and of course the professionals. If I just mention the objectives of the Sri Lanka Association for Child Development, we state that our objective is to promote, facilitate, and support advancement of professional knowledge and skills, research, and interest in child development and developmental disorders in children. So it's not just developmental disorders, we are talking about all children. And also to advocate to improve the quality of life of children in general and those with developmental disorders and their families. That is because our motto is all children have the right to receive the best opportunity for growth and development and reach their potential. So we are focused on developmental needs of all children. And our work, there are 4 targets in helping children reach their full potential. If there are any vulnerabilities, how to reduce those vulnerabilities, and of course to promote resilience. And they should develop into competent and self-reliant individuals in the future. And that is by coping whatever challenges in daily living that they encounter, and also in special situations. So therefore, the SLACD membership is multidisciplinary. It includes medical, allied health professionals, and of all sectors, professional groups who are actively involved in working in the field of child development and developmental disorders. So that would include teachers, professionals in education and in special education. Of course, our future is, we'd like to open it, or we aim to open to a much wider group, and that would include parents, of course. This is our logo, and the bud in the cage represents all developmentally challenged children in Sri Lanka. The blooming flower, which has broken through the cage but shares the same stem, symbolizes the freedom of upliftment of all children to bloom to their full potential. That's our logo. Now I would like to mention here, this was designed by Nawangi De Silva, a daughter of a pediatrician. She was 14 years at the time, now she would be 16. And the computer graphics were by Nirmal Borukgama, who was a final year medical student at the time. Of course, he is now a qualified doctor. I would like to recall the activities of the last year that we've had. There were many training workshops for child health specialists, the pediatricians, postgraduate doctors, primary health care doctors. We've got a lot of them involved, therapists, other primary health care personnel, and we focused on assessments and interventions and multidisciplinary care. We had workshops on cerebral palsy and autism especially, but even assessment of developmental disorders, because we had a workshop on using Bailey scale for child development, and training program for preschool and school teachers. We had parent forums which were exclusively for parents, and we had other events as well. I would like to go through some of the events in a slideshow. It's not complete by any means. It could have taken a lot of time if I showed you all the pictures, but I've selected a few. Bridging the Gap for a Brighter Future was our first conference, where Autism Speaks from the USA also participated. And it was a conference, especially we addressed the children with special developmental needs. And we had delegates from Autism Speaks talking to us and introducing their program, their initiatives, which are of course global. And of course they had to face certain questions from the audience, doctors and the parents. So we had a very productive workshop there. And you can see the very enthusiastic crowd in participating in the discussions. We had a media forum for parents, and the media personnel were there, and they were able to ask very specific questions about their concerns, about their developing, well, their children, their own children. And the expectation was that the media would report. And we had a few politicians we invited as well, especially one from the education sector who participated. This, on the 2nd of April this year, last year, we for the first time celebrated the World Autism Day, 2nd of April. And the Light It Up Blue campaign. And the main event was at the Colombo Town Hall. And this is the way we lit it up blue. It was quite beautiful in the night. There were few other buildings, iconic buildings in the city that were lit up. And the First Lady at the time was the chief guest, and there were several other important people who attended the event. And this was the team that made it all happen. I think there are still few people missing there, but they did a massive amount of work. We had a little celebration for the children in our clinic. That was our autism, the clinic for the autism, children with autism. And of course you can see one cutting the cake, the Light It Up Blue cake. These are the field level primary healthcare workers, and this was one of the training programs for them. And this poster is now distributed to almost all primary healthcare centers, which gives just basic features that parents can identify if the child has autism. And we had a group from Abu Dhabi. In fact, they visited in the last 2 years, came to us and conducted workshops, multidisciplinary workshops, on 2 occasions. And we are truly grateful to the work they have contributed. And this was part of the event. One of our events or work we did that we are really feel quite good about was at the national level. We worked with the Ministry of Education, and among the invitees, the personnel from the Education Ministry. We are grateful for involving us. And what we did was to get as many people or people who matter in education sector trained in child development, so that they understand children with developmental problems in their school setting, detect early the children with learning difficulties, give an assessment in the school setting itself, and be sensitive and considerate about them. So it was as I said, a national program where we had access to education personnel in the director level from all over the country, and that was quite an achievement. And these are some of the pictures from those workshops and training program. Also, we had workshops for pediatricians in Kandy, and for teachers and parents in Dharaniyagala. And these are some of the pictures. Okay, what's going to be our future work? We'll continue to work with the Education Ministry. There's much more work to be done. We've also made some recommendations to the National Education Commission. Things like giving multi-level qualifications to children with learning difficulties rather than just pronouncing them pass or fail. And also provide provision for home education and many more other things. So we need to pursue as to where they would take us to. Of course, not us, it's the children of this country. So we really have to look at the special education and help them improve the quality of care they provide. We are great believers in inclusive education, so we'll be working with the education sector regarding that. And of course, stigma, their rights, and the services, we would be contributing as much as we can. I would like to sincerely thank Dr. Ferdowsi Rastam Mehta, who has now left. He was the country representative for the WHO in Sri Lanka for quite a few years, and he was very supportive of us and was very accommodating and approachable. Dr. Nihal Jayatilaka was the Secretary Health at the time. He was very helpful to us with regard to the national program for child development that we have moved quite a way. It's kind of come to it's rather dragging its feet. So I hope the present government would take it forward. But Dr. Nihal Jayatilaka contributed quite a lot. Dr. Ratnasiri Hevage, who was the director of Lady Ridgeway Hospital at that time, and you were very supportive, and there are many stories we can say about the events that we conducted. Kumudini Hettiarachchi is a leading journalist who writes to the Sunday Times, and she was the one who carried forward all our requests for articles to be published on the events that we conducted. Then the delegates from Autism Speaks, they're very much in touch with us, Dr. Andy Shee and Michael Rosenoff. They were unable to attend this conference. The Council of the Sri Lanka Association for Child Development, well, they faced crises. They did a massive amount of work, and everybody supported. It was truly a team. So thank you. And of course the members, they were behind us. Today is my last day as the president. Dr. Samanmali Sumanasena will take over. She's a very enterprising, energetic person, will take everything forward much better than I did. And my very best wishes to Dr. Samanmali. Thank you.